had a feeling to speak more about more than just diabetes. Okay. Now, something that's different about me that you probably won't see with a lot of different other people, is that my every day in and day out, like I've mentioned, is not just diabetes or even endocrine related conditions. I talk to my patients about everything. I function as a family nurse practitioner. Now, being that diabetes is one of those conditions that the majority of my patients have, it has been very beneficial for me to speak to diabetes, hence why I wanted to go for the certification and become a diabetes educator. But I don't work in just a diabetes clinic. I don't work in just an endocrinology office. Nothing's wrong with that. If that's what people want to do, that's fine. But for me, my biggest focus has been quality of care. It has been chronic disease management because diabetes tends to run alongside other chronic diseases. So it's just not a one trick pony. I'm not a one trick pony. And I wanted to be able to bring more of that to you all. You may be asking yourself, why do you want to do that, Kim? Well, again, if you have followed me for any amount of time, I've been making content online, like officially as Kim E, the Diabetes MP, since 2019. So here we are in 2023. That's almost 4 years. We're coming up on 4 years of me launching my YouTube channel and my social media platforms as the Diabetes MP. And just to be quite honest with you, I find there are other subjects that I want to talk about and that I have knowledge over. Okay, so just to give you a little bit of background of me, some of you all may know this already, but for those who don't, again, like I said, I'm a family nurse practitioner, proud of that. I'm also a diabetes educator. Okay. What a lot of people don't know about my work history is that it was very diverse. I have worked in a number of different settings. I have done inpatient, I have done outpatient, I have done boutique clinics, I have done cash pay only clinics, I have done long term care, right? I've done NICU. A lot of people don't know that my very first job as a nurse was in the NICU. Okay. I started out doing a lot of critical care, and then decided to go back to school and do outpatient for personal reasons. But I didn't want to work in the hospital. That just wasn't my cup of tea. But that was the path that I chose for myself. But when I was working as a registered nurse, I always worked in, critical care, ICU, trauma step down. It was always like a specialized unit, right? Also, I have a lot of experience in leadership, especially healthcare leadership. Some of you may know that I have a consulting business, an education consulting firm, where I actually help organizations and clinics build out their programs, their clinical programming, as well as sustain that programming. So I'm really, really big into community health and really, really big in the 65 and older community, chronic disease management, all of these things I bring to the table. And I started to feel like I was boxing myself in. So again, I'm going to continue to talk about diabetes, education, and management. So don't feel like I'm transitioning out of that. I'm not. But I want to have also an outlet where I'm able to come and speak to you all about hot topics in healthcare,